Alcohol and Gambling Addiction: The Case Study of Jessica by Giovanni Di Stefano, the Chicago School of Professional Psychology. The following PowerPoint will discuss the case study of Jessica, a substance use versus a process addiction, the application of assessments, a diagnosis and level of severity, the levels of care, treatment through cognitive behavioral therapy and motivational interviewing, treatment planning, the Gorski relapse prevention model, and ethical standards. Jessica, a 27-year-old from Reno, Nevada, shows symptoms of alcohol and gambling addiction. She has been gambling and drinking consistently for the past 5 years, visiting the casino 4 to 5 nights a week and consuming 6 to 9 drinks a night. She gambles $100 a night, the money she wins and the money other men give her. At times, she has woken up next to these strangers. Her work has referred her to counseling. Substance versus process addiction. A substance addiction is a physical and psychological addiction to a drug that carries the additional harm as a direct chemical dependency to the drug itself. A process or behavioral addiction is an activity or a process that does not involve taking brain-affecting substances like alcohol, cigarettes, or hard drugs. Both addictions produce key changes in the brain by affecting the dopamine, also known as transmitters, pathways that communicate information in the brain. Studying the comorbidity of alcohol and gambling addiction guides the case study of Jessica, examines the causality, explores its roots, and how to treat the phenomena. Levels of care. The 4 levels to treat addiction consist of Level 1, outpatient treatment, Level 2, intensive outpatient IOP, and partial hospitalization program PHP. Level 3, medically monitored inpatient residential treatment, and Level 4, medically managed inpatient treatment. Jessica has been drinking and gambling consistently for 5 years. She is engaging in sexual behavior with strangers to feed her habit. These are chronic behaviors in an environment that feeds her habits and has created a lifestyle. Medically managed inpatient treatment is recommended for Jessica. Treating her requires taking her out of her environment and monitoring her 24 hours. Medication will be required to stabilize her while she detoxes. Daily assessments by professionals trained to adjust treatment have the expertise to stabilize her and prepare her for the next level of care. The application of assessments. The Alcohol Use Disorder Identification Test, AUDIT, or also known as AUDIT, was developed by the World Health Organization to assess alcohol consumption, drinking behaviors, and alcohol-related issues. The assessment consists of 10 questions able to be administered by the clinician or by the individual curious about their alcohol consumption. There are 2 versions, the clinical and the self-reported version. There is also a chart which illustrates the amount of drinks based on the alcohol proof of the liquor. The audit is applicable across the spectrum of genders and racial ethnic groups. Then there is the DSM-5 screen for pathological gambling. It is from the diagnostic criteria from the DSM-5 manual to indicate a potential issue and/or risk for someone looking to clarify if they have a gambling concern or gambling issues. The assessment consists of 9 questions. 4 or more yes indicate a diagnosis of gambling disorder. The tool is applicable to a process addiction. Diagnosis and level of severity. For this, we're going to be talking about alcohol use disorder. The DSM-5 defines alcohol use disorder as a pattern of consumption that leads to severe impairment or distress when an individual maintains 2 or more of the symptoms within a 1-year period. Diagnosing an individual with severe alcohol use disorder requires the presence of 6 or more symptoms. Jessica shows 7 of the 11 symptoms for alcohol disorder. Symptoms like being unsuccessful in stopping or lowering consumption, consuming despite the physical hazards, using despite knowing the physical and psychological harm, increasing intake to get the desired effect, alcohol withdrawal syndrome, and the need to gradually lower intake or take a substance such as benzodiazepine to avoid withdrawal symptoms were not measured as she just entered treatment. In treatment, these symptoms may be added. Jessica does not appear to be aware of the severity of her drinking. Next, we'll look to diagnose the level of severity of Jessica's gambling. Jessica's gambling shows that she has 6 out of 9 of the symptoms for gambling disorder. The 3 symptoms that she does not show are that she becomes restless and irritable when she's trying to stop. She has made repeated unsuccessful attempts to stop and gambles to relieve her stress. Again, because she has just entered therapy, there is not enough information to know if these 3 symptoms will be added to the 6 other symptoms that the client shows in her gambling behavior. It is likely that the diagnosis of gambling disorder as moderate will likely be diagnosed as severe when she begins to understand her gambling behavior, which, like her alcohol consumption, she is not fully aware of. Treatment through psychotherapy. So I would use cognitive behavioral therapy to treat Jessica. CBT is the classification of psychotherapy that is rooted in social learning theory, which focuses on how thought interacts with emotions to produce behaviors, or the ABC model. Functional analysis and skills training are the 2 critical components. Functional analysis guides the client to focus on the triggers that lead to high-risk behaviors. For Jessica, it is gambling. Functional analysis maps her feelings, thoughts, and behaviors she associates with this state. Obviously, it's also used for alcohol as well. Skills training is an individual training program to guide in the learning of maladaptive behaviors. The goal of skills training is to identify and reduce habits associated with the client's unhealthy lifestyle. For Jessica, the first step in skills training is to identify these variables through documentation. Another form of psychotherapy that would be useful would be motivational interviewing. Like CBT, motivational interviewing is client-centered. One key difference is that motivational interviewing applies methods to enhance the variable of motivation by analyzing and addressing client ambivalence. Both can be narrative-driven, but depending on the technique, motivational interviewing explores the deeper issues behind the thoughts, feelings, and behaviors. Behavioral therapy identifies them. Motivational interviewing asks Jessica to examine why she is entering therapy and explores how changing and not changing affects her gambling, drinking, and social surroundings as well. The next part would be treatment planning. Treatment planning would consist of taking Jessica out of her current environment. For her, it's become a lifestyle. Her gambling habit, going to the casino, as well as drinking as much as she does. And she's been doing it for 5 years, so it's critical to get her out of that environment. I would place her at a level 4 medically managed inpatient treatment center. For her to detox and also to be monitored 24 hours a day by professionals. who are certified to work with an individual with the severity of her alcohol and gambling addiction. I would also assess her alcohol intake and her gambling habit, as well as has been seen her alcohol addiction is severe, according to DSM-5, and she's also moderate when it comes to gambling, and that's what she's not aware of. When she comes into treatment, she'll become more aware of that. So that's part of the treatment plan, to make her aware of the severity of her addiction. I would use psychotherapy, CBT, and motivational interviewing to provide the foundation to speak about her lifestyle. I think that her gambling and her alcohol have become a lifestyle to her. So these two types of psychotherapies will help her to explore, one, to stop certain behaviors that she's engaging in at the short term, and another one just kind of like digs a little deeper into those areas that perhaps she's unwilling to go to right now. Of course, she's going to need medication to wean her off the alcohol, and also medication to kind of stop her thoughts when it comes to gambling, because these type of thoughts and these type of behaviors might leak into other areas while she's stopping. So it's important to kind of address all that. I would prepare her for her next level of care. Of course, if she gives consent through CBT and motivational interviewing, I think those would be kind of would prepare her for, and also detoxing as well with medication, prepare her for the next level of care. And then finally, we would have to develop a relapse prevention plan for her continued care. And this is not only when she's at the treatment centers that she eventually goes to level 3 or level 2 or level 1, but also in her personal care when she leaves treatment, that she's able to have a good foundation that she's able to work with and understand her behaviors and know what's causing them, so she's able to address them and see them before she relapses. Continuing with treatment planning in more detail, I think for goals for alcohol disorder, I think a critical goal would be obviously detox, because of her drinking and the severity of it. The use of medical detox to rid the body of toxins has become a cornerstone to a gradual healthy recovery in general. Detox will stabilize Jessica and prepare her for the next step in her recovery. Also, I would use motivational interviewing, as I've discussed. It's a brief form of therapy aimed in addressing resistance and enhancing motivational change for her. For goals for gambling disorder, I would choose to help the client understand the cycle of compulsive gambling and how it relates to other addictions. I think that's really an important area to kind of see the relationship between her alcohol and her gambling, and also her taking the money of other men, and also consuming the alcohol of other strangers, and waking up in the same bed with these strangers. I think they're all obviously connected. An intervention that I would use for gambling would be well, the most utilized form is cognitive behavioral therapy, to address the thoughts and behaviors which are causing Jessica's gambling, not only short term but long term. So CBT and MI, or cognitive behavioral therapy, and motivational interviewing really are interchangeable and can actually be used obviously in both of her addictions to address the addictions. And I would also use, for another intervention for gambling, I would use group therapy. This could be a 12-step program, or Gamblers Anonymous. And just to help her see and relate to these behaviors, a lot of times members or groups of people who belong to these particular type of groups share obviously commonalities, and through those commonalities they're able to see certain things that they're not willing to either admit to themselves, or that um, just to, and, that's it. As far as the prevention relapse model, I would use the Gorski relapse prevention model. The Gorski relapse prevention model consists of identifying and addressing early warning signs of relapse through the following 9 steps, which include stabilization, assessment, relapse education, identifying warning signs, managing warning signs, recovery planning, inventory training, family involvement, and a follow-up. Jessica struggles with alcohol and gambling addiction, as we've spoken about. She would benefit from the Gorski relapse plan in that it addresses her behavior, cognitions, and environment relationship. In the environment relationship she has had with addiction for the past 5 years, educating her on the warning signs causing her relapse will help her better determine pattern sequences which lead to past relapses. Another element of the plan is warning signs of management. Jessica needs to learn how to manage these behavioral patterns without resorting to alcohol and gambling. Learning non-chemical problem strategies requires developing coping strategies. This includes applying mindfulness and CBT techniques to address self-defeating cognitions. Ethical concerns for the case of Jessica, I would say the first one is obviously consent. It's not really clear whether she has kind of accepted going to counseling by her work because she wants to keep her job. And as we go through the process of just having her understand her lifestyle, it's really important that we get the right consent and that we know she's consenting willingly to the treatment that she's being given, especially if it's a level 4 treatment, because it's the highest. We want to make sure that she's aware of what she's signing up for. So just being honest and being open about what is required, and to be aware that she is willing with her consent. Also placing her in the correct level of treatment, obviously. Having professionals that are that understand her care, or able to see the case study of her, and are able to address the severity of her addictions. Obviously, confidentiality. She might be concerned that work will, take issue with her having to leave work for a certain amount of time, or having to change her environment. So, finding ways of communicating the importance of confidentiality, not only to her, that she's able to trust us and be open, so she's able to engage in her treatment, and also communicate this in a certain way that she's comfortable with her own work in case she has to take a leave of absence, and also diagnosing her correctly. The last thing that we want her to that we want to happen is for her to be diagnosed incorrectly, whether it's less severe or more severe. I don't know how much more severe you can get with her case, but I'm sure there are some out there. There are plenty of out there, but just being able to diagnose her correctly, so she's able to get the right kind of treatment, and she is able to get well and continue in her life.